So I think we'll begin. Thank you so much, everyone, for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient and Family Learning Center. Today's program is a special collaboration between the Blum Center and Henry and Allison McCance Center for Brain Health. Before we get started, just wanted to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing today's recording, feel free to visit our Blum Center website at massgeneral.org/Blum-Center. Please note everyone is in listen-only mode. Everyone has been muted so that we can listen to today's speaker. If you have any questions for the guest speaker, please use the chat feature, which is located at the bottom of your screen. Only Blum Center staff and the guest speaker will see your questions. We'll have time for them in the end, and please be sure to not share any personal medical questions or information in the chat box. If you have a personal medical question, please ask a doctor. Dr. Rosen, would you like to pull up your slides?
Yes, thank you, Amy.
Great. So next, I would like to introduce you all to Dr. Jonathan Rosen. He is a neurologist. He is the former chief of neurocritical care, a faculty member in the Center for Genomic Medicine at Mass General. Along with colleagues, Drs. Rudy Tanzi and Greg Friccioni, Dr. Rosen established the McCance Center for Brain Health to develop tools and practices for the prevention of brain disease and preservation of brain function across the lifespan. In recognition of Brain Awareness Week, he joins us today to present on maximizing human potential through brain health. So please join me in welcoming Dr. Rosen.
Thank you very much, Amy, and it's a real pleasure to be here to join the Blum Center again for a session on the brain. Ever since the founding of the Blum Center, we've seen a real explosion in the way we doctors and nurses and therapists have been able to communicate with our patients and provide the kinds of educational materials that I know my patients find very helpful. So I hope for all of you listening that you find what we have to share today to be useful, and I'll look forward to some of your questions at the end. So when we talk about healthy aging and healthy brains, our focus really is on how one acts in the world. You know, the key questions: what can I do for myself? What can I do for my loved ones, for my children, for their children? This is really what brain health is about, and this is how we conceive of maximizing human potential through brain health. Healthy aging is a phenomenon that's often confused with the acceptance of memory loss. There was an old-fashioned term that we don't use anymore called senescence, senility. But the truth is that we all change as we age. And from this figure, what you can see is that as we age, there are different changes that occur in the different ways in which our brains work. Processing speed, short-term memory, long-term memory, working memory, verbal knowledge. These are all different ways in which we can characterize the function of the brain in real life. We all know that as we get older, it's often harder for us to take in new information, or we have to take it in more slowly. And that's normal. And you can see that's the red line here. That's processing speed. Similarly, we all know that we used to be able to remember things more easily when we were younger, and that function goes down with age too. That's normal. One thing that is also normal, though, and this is the orange line, and I apologize, this is a misalignment here, but the orange line goes with verbal knowledge. As we get older, we get wiser. So there are advantages to getting older, many. And one of them is that this aspect of our brain function tends to improve. And so it's important for each of us to understand that this is reassuring. In other words, there's a normal age-related change to the way our brains function. There's some improvement, and there's some aspects to the way we work in the world that we're not quite as quick and not quite as sharp as we used to be. But there's no reason why any of these changes should limit our potential and our ability to act in the world to be effective and to maximize our potential. This is in stark contrast to cognitive impairment and dementia. So you remember, these are the lines, the graphs, the changes in normal aging. What you see here is that cognition, all of these lines tend to start to go down quite substantially to the point where you get either mild cognitive impairment, and often that will progress to frank dementia. So there's a real difference between what happens in the setting of Alzheimer's disease, for example, or in the setting of dementia related to diseases of the blood vessels and healthy aging. So where can we learn how to preserve our brain health as we age? And this continues to be a challenge, particularly over the last year, when we've all been so interested in news related to the pandemic. Often it's the lay press where announcements, discoveries, advice are first made available, as opposed to the scientific literature. And so for many of us, the challenge is keeping up with the latest article in the newspaper, the latest online advertising. And it's hard to distinguish what's reliable and what's not reliable. There are some sites that are quite reliable. For example, I recommend to everyone looking up and bookmarking the AARP Staying Sharp site, and certainly reputable news organizations will cover the news. But the problem is we never know if this announcement of a discovery is really going to be confirmed going forward, or is just was a flash in the pan, and then when other scientists try to confirm this new finding, we're not able to do it. And so it turns out that we misunderstood what we were looking at in the first place. So the key is that science is this wonderful process of replicating, discovering, replicating. And that's where our center and our hospital comes in. We're always doing new experiments to figure out what's best for the brain. And then we're always testing to make sure the results of those prior experiments are indeed true and not some aberration, as we would call them. So these are photos from my lab and a lab I share with, in that case, this is my colleague Alex Soukas in the Center for Genomic Medicine, who studies how individual cells age. But we're always looking for the next experiment to do to understand what's normal aging, what's diseased aging, and what needs to be treated. And we do this not just in the laboratory, but we do this by looking at everybody's EEGs and MRIs and CAT scans. And we have a biobank, and I encourage you to consider joining the biobank if you haven't already. These are all ways in which people like us can participate in the discovery process and provide the crucial data that allows us to ask the question, what is healthy aging of the brain? Where is brain aging unhealthy? And what can we do to preserve brain health? And brain health is really the crisis of our century. Many consider it in partnership with, or sort of in tandem with the climate crisis, to be the key challenge that these next several generations have to overcome. Brain diseases are the leading cause of disability around the world. They claim an estimated 9 million deaths a year around the world, but we think that figure is an underestimate. The impact on the economy of just one brain disease, like Alzheimer's, is billions of dollars a year. But when you take all brain diseases, depression, anxiety, strokes, Parkinson's disease, we start to look at tens of billions, even hundreds of billions of dollars a year. The challenge with so many brain diseases is that we're in a reactive mode. So once you have something wrong, or your loved one detects something wrong, excuse me, that's a trigger to go see a doctor. What we don't have is a practice of preserving brain function, a preventative care practice, just the way we do for cardiology, one that's embedded in primary care. And this is the gap that we at the McCance Center and our colleagues around the world are committed to addressing and filling. So right now, brain disease is treated rather than prevented. There aren't standard assessments the way when you go to a doctor's office, for your primary care visit, you have your blood pressure checked or your cholesterol checked or your cancer screening done. There's nothing like that for the brain. And so our mission is to develop that for the brain. And then finally, brain health, brain care is much beyond what happens in the doctor's office. And there really isn't a unified approach, let's say, to the schools, to school health, to workplace health that incorporates preserving brain health and preventing brain disease. So the McCance Center is both a center for researchers and a center for policy, and importantly, a center for clinical care. We've established the first clinical unit, where instead of just treating individuals who have active disease or brain injury, so these are individuals we would color as red here, we treat individuals who are at high risk for brain disease. The yellow here, these would be people whose first-degree relatives have a brain disease, or who have certain risk factors, or who have recovered from their brain injury, but now need aggressive work for what we would call secondary prevention. And we also treat individuals who aren't at high risk, but are committed to doing what's best for their brain and developing a brain healthy approach to their healthcare. The overall goals of the center are to identify a set of indicators of brain health. So these would be what someday your doctor would measure in their office to assess how well your brain is functioning and whether you're doing everything you can to preserve your brain function and prevent brain disease. And you could imagine these indicators would be checked once a year or even more frequently as a gauge of how well you're doing or whether your risk is changing. In tandem with those indicators, we're committed to working across disciplines and frankly across the globe with collaborators to discover those treatments, those interventions as we call them, that can be administered to preserve and improve brain health and function. These will include, no doubt, a set of lifestyle recommendations, as well as new treatments, could be drug treatments, that will make your brain stronger based on scientific evidence. And we're going to come to some of those things later in the talk. And then finally, the most ambitious goal here is to take what we learn about indicators and interventions and integrate them into primary care across different populations, across different locales, so that all of these discoveries can be made available and become the cornerstone of a new type of primary care that is focused on preserving brain health as well as heart health and preventing cancer. So our approach is comprehensive. As you can see from looking at our website, the three founders of the McCance Center come from very different backgrounds. I'm a clinical neurologist and a clinical researcher. Rudy Tanzi's a neuroscientist. And Greg Fricchione is a psychiatrist. And the three of us are all committed to an integrative approach that includes both lifestyle interventions, mindfulness, as well as the most sophisticated drug treatments, and embraces the latest ideas in fields like precision medicine, systems biology, genetics, neuroplasticity, and importantly, neuroinflammation. So we bring the medical advances together with the integrative advances, focusing on what's so important to all of us, qualities like joy, peace, equanimity, and we integrate them into an approach to brain health that allows us to treat, in the McCance Center, to treat the whole person, but also as we think about our much broader mission, again, to conceive of the whole person whose brain we want, whose brain we are caring for. A vital component of health, and brain health in particular, are the social determinants of health. And the pandemic has given us a stark reminder of how vital these aspects are to our healthcare. And so this too is an important focus of the McCance Center. You can't necessarily avail yourself of the most cutting edge primary care, for example, if you don't have adequate health insurance, or if you can't afford your medications, or if when you go to your physician isn't able to provide you culturally appropriate care. In many communities, there's limited access to primary care. That also has to be overcome. So you can see in each of these categories, all of these can interfere with our ability to access the kind of quality healthcare that we at the McCance Center and we at Mass General, and frankly, we throughout the medical profession envision as being universally available to anybody who needs that care. So how must we care for brain health? It's a collaborative effort. And it's a collaborative effort that's focused around patients and caregivers. So one of our sort of founding visions is that for each of us, our brain health is about a whole lot more than just us. It's about how we can care for the ones we love. And so it's important always to think of brain health as something that is a concept that is one we share with our loved ones. And this is important too because it gets at relationships, which are so fundamental to human potential and ultimately to brain health. So you can see here, these are the kinds of individuals, mind-body practitioners, therapists, nurses, and physicians who make up the care team at the McCance Center. And then our researchers are always informing the latest advances, and we're always supplying important observations from our clinical work to our researchers. And finally, it's very important to acknowledge once again the importance of schools and community organizations, just as some examples of how integrating brain health, integrating primary care of the brain must go well beyond the doctor's offices. So as I alluded to, here are the three founding directors of the McCance Center. And once again, just to be clear, you've got a clinical neurologist, clinical psychiatrist, and a neuroscientist really committed to leveraging all that each of us has learned in our different domains to enhance the mission of and advance the mission of the McCance Center. So I'm going to talk a little bit about Alzheimer's. I wouldn't say it's everybody's favorite topic, but when we think of brain health as we age, most commonly, what each of us is worried about is that someday we're going to develop this horrible disease. And so what you can see here, these are cartoons of what the brain would look like if you were to take a brain image and just look at a slice down the middle. And we'll start here at the bottom. This is a healthy brain. Whoops. This is a healthy brain here. And what you can see in this healthy brain is that the volume is full. It's got these little indentations we call sulci, which is the plural of sulcus. And the brain is divided into what we call white matter and gray matter here. And the gray matter are where the cell bodies of most of our neurons are located. And if you think of this as normal, here's what happens as Alzheimer's progresses. You've got the loss of volume. These sulci get much wider. This is normal versus abnormal. And then as Alzheimer's progresses, you can see dramatic loss of brain volume. And that's due to the fact that all of these cells are dying. These neurons are dying, and they're dying through a process that has to do with the accumulation of amyloid plaques, as we call them, and neurofibrillary tangles. I'm sure you've heard those terms. And this process is called neurodegeneration. What neurodegeneration means is that these cells are dying because of some process, not because of some external, let's say a trauma, or because blood supply has been cut off, as you see in a stroke, but because some process within the cells has been triggered to lead to dying. And those processes can be triggered by all sorts of early events in life. They can be triggered by genetic changes that we inherit. They can be triggered, we think, by chronic low-grade inflammation, which is something we'll talk about when we talk about steps you can take. A lot of this is being evaluated and being worked on, in particular in Rudy Tanzi's lab. And as many of you probably know, we have been searching for drugs that can stop or reverse the effects of Alzheimer's for years and years without success. Just looking at this cartoon, you can imagine that by the time there's already loss of these cells, maybe it's too late. It's a lot to ask to either regenerate or stop a process that's become so pervasive. Now, there was just an announcement last week of a new drug from Eli Lilly that appears to perhaps slow the progression a little bit of Alzheimer's disease. So we're very excited about that possibility. Let's see what the follow-up tests look like. But if you imagine this is what a healthy brain looks like, we want to keep our brains looking like this and never have them start to lose that volume, those cells. So there's lots of activity, lots of research being done today to try and get at Alzheimer's before it's really had an impact on those neurons, before you started to lose them. And these are just a couple of articles. There's a big group at Mass General and the Brigham, led by Risa Sperling and others, who have been studying individuals at risk for Alzheimer's but who don't have it, and measuring different aspects of the brain using something we call PET and an MRI imaging. There are blood tests that are being evaluated to see if you can track brain health through the blood, and that's an area of active investigation at the McCance Center. And then there are all sorts of interesting technologies that are being applied. Can you look at our eye movements? Our eye movements are very quick. Might they slow down a little bit before Alzheimer's has taken root? Might we just check eye movements once a month, once every 6 months, and see that all is okay, and use that as a screening test? And this is an example of some goggles that have been created to measure eye movements very, very precisely. So all of these kinds of questions are all devoted to finding what we call an indicator, some test that you can administer before anyone gets sick that can measure the health of the brain and that can be used to gauge whether somebody might benefit from a new treatment or further testing. So my colleague, Dr. Tanzi, has developed a simple mnemonic for the lifestyle interventions that are a subset of what we recommend for preserving brain health. It's called SHIELD: sleep, handling stress, interactions with others, exercise, learning new things, and diet. And what we've learned, and many others as well, is that these lifestyle interventions do work. They do have an impact on brain health, and they're relatively risk-free. So the initial focus of the McCance Center has been to develop tools to ensure that individuals are able to enact these lifestyle interventions. So I'm going to end now with kind of an overview of what we at the McCance Center recommend as what you can do now to preserve your brain health and prevent brain disease, or at least postpone it. And these steps apply not just to Alzheimer's, but also to stroke, to depression, anxiety, to Parkinson's. So what we've learned is that the brain is a single organ, and so much of what we can do now is good for preventing a whole host of brain diseases. So the first I'll start with is blood pressure. It turns out that blood pressure is one of these measures that any indicator for brain health is going to include. In other words, you're already, when you go to the doctor every year, having one measure of brain health checked, and that's blood pressure. We know that blood pressure as we age tends to go up, And if it goes up too much, that it increases our risk of a whole host of brain diseases, particularly stroke, but others as well. And we also know that if you bring down the blood pressure, that your risk of these brain diseases goes down. But most frustratingly, what we and others have learned is that roughly half or more of us don't keep our blood pressure in the proper range. And there are all sorts of reasons for it. One is that we're all averse to trying a new medicine. And fear of a medicine is often more overwhelming in the moment than being able to understand rationally the benefits of the medicine. And so I spend a lot of time talking to my patients about how taking your blood pressure medicine is a sign of health rather than a sign of disease, and how important it is to learn to measure your own blood pressure so that you can monitor it at home and ensure that at some point after your doctor has started your treatment, that your blood pressure really is in the normal range. So that's the first lesson here. If your blood pressure is borderline, as they say, or high, this is an opportunity for you to take a step to preserve your brain health and prevent brain disease. So I encourage you, if you have high blood pressure, learn how to use a home blood pressure monitor, and be sure that you're talking with your doctor to make sure that your doctor is satisfied with your blood pressure control. For many of us, as we get older, our blood pressure gets more difficult to control and we have to add more medication, and that's okay. Blood pressure medicines are some of the safest medicines there are, and the benefits of blood pressure, not just for your brain, but also for your heart and your kidneys, are enormous. So it's a nice opportunity to do something good for your brain. Next, after blood pressure, is sleep health. Most of us probably need 7 or 8 hours of sleep a night. Some of us need fewer, some of us need more, but all of us need a certain block of high quality sleep every night. And when I say need, I'm referring not just to the fact that you know the difference the day after when you've had a good night's sleep or not a good night's sleep, but also we know that accumulated sleep debt and constant poor quality sleep is a risk factor for brain diseases, stroke, Alzheimer's, depression, and others. So this is something you can do today to reduce your risk for brain disease and improve your brain health. Sleep health isn't always so easy. Often it takes a conversation with your doctor. Sleep health is generally the most frequent complaint that our patients at the McCance Center have. And there's a lot of work to be done to figure out why it is that one's sleep is poor. Sometimes it's due to a condition called obstructive sleep apnea. And other times it's due to challenges in the environment in which one sleeps, one's bedroom, how one prepares for sleep. But no matter what the challenges are that we face with our sleep health, there are solutions, but it takes attention. And so I encourage everybody to make sure that you're focused on sleep health. Another aspect of brain health is meditation and stress reduction. Meditation is something that more and more of us are doing. There are lots of ways to take it up, but anything that you can do to reduce your stress, to reduce your reactivity, is going to have a long-term impact on your brain health. Why? Well, the simple way to understand it is that when we're stressed, our level of inflammation in the body, there are hormones that are activated. There is a body's response to stress that essentially keeps the immune system in a heightened state. And that heightened state for a long time can be unhealthy for brain cells. And there is some data to suggest that that heightened state of inflammation is one of the key contributors to risk of developing Alzheimer's disease, for example. So we strongly recommend finding ways to reduce one's stress, and meditation is a really, really effective way to do that. Along those lines, it's very important that each of us acknowledge anxiety. Anxiety is a fundamental part of our lives, And often it is the barrier that keeps us from seeing the doctor or from taking steps to take good care of ourselves. And so we often work in the McCance Center with our patients, what we call health-related anxiety, to help them identify that anxiety and eliminate it as a barrier to taking better care of themselves and their loved ones. Physical activity is a very effective way of achieving all sorts of things. Not only does it reduce your risk for brain disease, but it also reduces stress, improves sleep, often improves blood pressure control, and can contribute to reducing anxiety. So there's nothing that physical activity can't be recommended for. And again, it's hard. Each of us is different. We have different restrictions on what we can and can't do, but everybody can find a routine of physical activity, physical exercise that can ensure that they're doing the most they can to reduce their brain risk for brain disease. The last thing I'll comment on, because we get so many questions about luminosity and other games for which there really is no evidence that they help. But what I think we would all agree on is that cognitive training employed in real life, where you're continuing to try and solve the problems that come up in your life or those of the ones you love, that is a very, that has lots of benefits for how you feel. And it has lots of benefits for stretching you in ways that we are confident is helpful to brain health. But even if it's not, the impact for you and on those you love is so positive that it's worth pursuing. There's no downside to using these computer-based brain training applications, no downside to continuing to do things like the crossword puzzle. And they may help, but it's important. We always reassure our patients that you needn't go out and spend lots of money on these things in order to get the benefits of learning new things. Diet is an important component of brain health as well. And there, I think the safest approach is to use the Mediterranean diet and other diets that have proven of great benefit in heart and cancer health. We're looking into the specific impacts on the brain, but as of now, there aren't good clinical trials as there are for heart health and cancer care. So I think that the take-home message is that your mind and body today are the results of your habits yesterday. So why not start today on your habits? Your mind and body tomorrow are the results of your habits today. And I want to acknowledge the wonderful team of clinicians. Here's Dr. Marie Pazinski, one of our most senior brain health specialists at the McCance Center for Brain Health, who have really been the innovators in developing these approaches to brain care. And I'm delighted to answer your questions. Thank you very much for your attention.
Thank you so much, Dr. Rosen, for your presentation. It was very helpful. So now we are toward the end of the session. If you have any questions for Dr. Rosen, feel free to enter them in the chat box. Dr. Rosen, you mentioned Mediterranean diet and helping brain health, brain functioning. Can you tell us a little bit more about Mediterranean diet, what that entails?
The Mediterranean diet is a diet high in particularly fruits and vegetables, low in saturated fats, avoiding meat, using lean protein, as we tend to call it, chicken and fish. That's the sort of general approach. There's a wonderful website, the American Heart Association. If you go on the website, the American Heart Association, you'll find all sorts of wonderful recommendations around diet, including recipes and suggestions for how to integrate the Mediterranean diet into your own particular lifestyle. Each of us is different, so each of us needs to figure out how particular dietary recommendations can be compatible with the way we live, we work, we shop, we eat, and with whom we eat.
Mm-hmm. And then you also mentioned physical activity. Are there any particular exercises that are more beneficial than others?
Well, we recommend that you're getting 20 to 30 minutes of physical exercise a day, where you get your heart rate up. That can be a brisk walk, it can be cycling, it can be walking the stairs, but it is important to get the heart rate up. And we also recommend stretching, regular stretching, excuse me. And so yoga is often the cornerstone of many of our patients' routines. The wonderful thing about yoga is it comes in all sorts of shapes and sizes. But fundamental to yoga's impact on brain health is, we think, the impact of stretching the muscles. Stretching the muscles seems to have a systemic effect. We don't know exactly what it is, but you could imagine that when you're stretching, you're releasing all sorts of good things into the blood, and those good things travel to the brain. But stretching is a very important part of our routines, particularly as we age, because stretching is also helpful to preserving mobility. So for those of you who are contemplating starting an exercise routine and aren't exercising regularly now, I encourage you just to confirm with your own doctors that what you're planning is consistent with your health. But it's very clear that regular exercise, 20 to 30 minutes a day, if you can do it, but at least 5 days a week, where you're getting your heart rate up, is crucial. Then the other piece that I will say is we're learning more and more about the benefits of weightlifting as we age. So if you want to do the holistic package, it's aerobic exercise where you get your heart rate up. It's weightlifting or working with those bands 3 times a week, I would say, to keep your muscle mass and your muscle strength, and then regular stretching with yoga or some equivalent to work on flexibility, and then you're set.
Great. Any other tips to provide, given that, we're still in the middle of winter, and given the COVID-19 pandemic, we're all indoors now? Any tips on how we can stay active while we're inside?
Well, it is the $1,000,000 question. The best news I can offer you is that despite today's temperatures, it is going to get warmer and we'll be able to get outside. But I think that, there's one of the things you can do is there are these many types of video trainings available for both aerobic exercise and stretching and yoga. And some of our community centers are offering them free of charge. There are guides on the website, for example, of the American Heart Association. But what many of my patients and I myself have adopted are these stretching bands. You can use these bands in all sorts of creative ways, both to generate resistance and also to work on stretching. And they're inexpensive, they're not heavy, and you can use them both to work on flexibility and also strengthening. And then a lot of people have different preferences for exercise machines. I don't know how you can do aerobic exercise indoors without a machine.
Can you share a little bit more about the McCance Center and what types of programs and services that you offer?
Sure. So the McCance Center is a combination of a research center, a clinical center. We also convene meetings for researchers and clinicians from around the world to focus on topics of particular interest to our mission. And we also fund innovative research programs that we think are really going to change the future of brain health. For patients, we have a clinical operation. You can call and make an appointment. You can go on the website. Our services are devoted to individuals who are either at risk for brain disease or who want to preserve their brain health over time to develop best practices. And one of the initiatives that the center has undertaken is we're partnering with some primary care practices, soon to be named, to develop the McCance formula for primary care, so we can get it out of the clinic where unfortunately we don't have enough bandwidth, as we say, to see everybody who wants to see us.
At the moment, are all visits virtual, or can you see people in person?
There's a mix. We have, because still of our capacity constraints, more of our visits tend to be virtual than in person, but we do both.
And what would be the next steps if someone were to be interested in being seen at the center?
I think we supplied the website and the phone number. In fact, if I can put up my last slide, let me do that again. That's the phone number for the McCance Center, 724-4881, and then you can find us on the web at massgeneral.org.
So if someone's interested, can they call directly, or would they need a referral from their primary care doctor?
That depends on your insurance. So that would be something you'd have to talk with your insurance or check the policy. But we will certainly make an appointment with anybody who wants to see us. But what we won't be able to tell you is whether you require a referral.
Okay. Great. So we'll give it about another minute to see if anyone else has any questions for Dr. Rosen. While we wait, Dr. Rosen, do you have any final thoughts you'd like to share with the audience today?
Well, what I would say is that this is something that brain health is something that you can't take on all at once right away. Our approach is to work with patients on what we call the lowest hanging fruit. So what's the one change that is going to be most beneficial most quickly for you, or is easiest for you to undertake? So that might be blood pressure, it might be sleep, might be meditation. Often we will find that our patients have other conditions that are important to treat for their brain health, and so that's going to take priority. But the key is to accept that each of us can't do everything all at once, but if we pace ourselves, we can do almost everything over the course of a year or two and really get into a very good approach to brain health that's going to have an impact not just on brain health, but on the rest of our health.
Thank you. All right, so I don't think I see any other questions in the chat box, so I think it'd be okay to end early today. Thank you so much, Dr. Rosen, for a very helpful presentation. I hope everyone found today's presentation very helpful. If you're interested in viewing the recording for today's session, feel free to visit the Blum Center website. I'll give it about a week or two for it to post online. You can visit our website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you. It was a pleasure.